Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Tuesday, June 16th, and this is a daily briefing. Today I'm going to update you with the current case counts, including new active cases in Missoula County. I'm going to review the symptoms of COVID-19, as there were a few more symptoms that have been added by the CDC in the last week, and I'll talk a little bit more about what practicing safe behaviors during large events or gatherings looks like during our reopening. So today, Missoula County has added 2 new positive cases of COVID-19. Preliminary investigation indicates that while one of the cases had travel history, the other had no travel history or known contact to a known case, meaning that there's evidence of community spread in Missoula County. These cases and known contacts are in quarantine and isolation, and they will continue being monitored and supported by medical staff as needed. So this means that to date, we've had 44 cumulative positive cases in Missoula County. 42 of those were identified by testing and 2 were epi-linked. We've had 40 recoveries and 1 death, and we have 3 active cases currently. The state of Montana is reporting a total of 614 cases, including 5 new cases confirmed this morning. In addition to the new cases in Missoula County, new cases are also being reported in Custer and Yellowstone counties. The state DPHHS is reporting 60 active cases across Montana, and we've had 19 deaths statewide. First, I just want to let everyone know that last week the CDC expanded its list of symptoms associated with COVID-19. The symptoms are fever or chills, cough, shortness of breath or difficulty breathing, unexplained muscle or body aches, new loss of taste or smell, sore throat, nausea or vomiting, diarrhea, and the new symptoms that were added are fatigue, headache, and congestion or runny nose. If you're experiencing any of those symptoms, please call 258-INFO to schedule a test or contact one of the providers that are listed on our website at missoula.co/cvirus to get a test scheduled. Next, I'd like to revisit what practicing safe behaviors during large events and gatherings looks like, which is particularly important to review as the country reopens, the state reopens, and we continue to see cases rising in rural America, including Montana. Last week, the CDC released guidance urging organizers of large events and gatherings to strongly encourage the use of cloth face coverings during events to reduce the risk of spreading COVID-19. Since we know that this strain of coronavirus is transmitted through droplet spread, and we know that people can have COVID-19 for an average of 5 to 6 days before presenting with symptoms, we can easily minimize the risk of exposure and transmission by continuing to wear cloth face coverings, especially during larger events when it is difficult to maintain safe space between attendees or participants. We've seen more and more demonstrations across the country, bringing hundreds, if not thousands, of people together, united by shared belief, elevating a single message through a diversity of voices. We have constitutional rights to peaceful assembly and speech, and we have a moral obligation to practice these rights safely, which includes taking COVID-19 into consideration. As the country and state reopens and travel restrictions ease and group sizes increase, we must remain diligent about safety. Continuing safe practices not only protects you, your friends, loved ones, and community, but it helps protect our healthcare hub, which serves a community much larger than just Missoula or Missoula County alone. We are all eager to return to a sense of normalcy. The summer months are upon us, and we are really used to being able to get up and go wherever we want, whenever we want. We can still do that, but much like you have to check and recheck your pack before you go for a hike, for all of the essentials, we need to check and recheck our ideas about safety and preparedness before participating in large events. If we can shift our thinking about safety and preparedness to include COVID-19 safety precautions, we can really increase public safety and reduce the risk of COVID-19 exposure and transmission. So, for example, if I'm going for a long hike in the woods, I want to make sure that I have my maps and roads and accessibility. I make sure that I have plenty of water, first aid supplies, a windbreaker, sunblock, all of those things that we want to take with us in order to be safe. If I'm bringing my dog along, I want to make sure that there's enough water and snacks for both of us, as well as some first aid supplies for my puppy. I would also follow a similar thought process ahead of attending a larger event or gathering. Instead of checking and rechecking my pack for hiking essentials, I'd check my pack for those things that I need to participate or attend an event in the safest way possible. I'd want to make sure that I have water, again, super important, You will also want to make sure that you have hand sanitizer and a cloth face covering. I might also want to do my homework before attending an event or participating in a large gathering. For instance, do I know the purpose of the event or what it represents? Have the organizers planned for and communicated how they're going to promote and ensure safety and safety of your health during the event? What is expected of me if I attend or participate? Do I have the supplies that I need to safely attend and participate in the event? And so on and so forth. COVID-19 is still very much with us. We're seeing this as new cases are increasing in states as states are reopening. While numbers in Montana have been relatively flat or at a plateau, we are starting to see our case numbers increasing again. These new cases represent a variety of transmission pathways, whether it's travel related, connected to a known case, or community spread, which means that there are a variety of ways to approach ongoing safety. We can stay closer to home, we can keep our social circles small, maintain 6 feet distancing between ourselves and others, washing our hands thoroughly and often, we can clean and sanitize frequently touched surfaces, and yes, we can continue to wear those cloth face masks. State numbers are increasing. Last week, new active cases more than doubled our cases from the week prior in the state of Montana. We expect this upward trend to continue, but we also expect to manage it with our knowledge, skills, experiences, and abilities to continue practicing that safe behavior. For Missoula County and for our neighbors across the state, let's just continue moving forward safely together. So with that, I just again want to say thank you for continuing to maintain that vigilance and continuing to practice those safe behaviors so that we can really control the numbers of cases that we have in our community. So that's it for my daily briefing today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook for really great information there. You can check out our website at missoula.co/cvirus. And you can call 258-INFO if you would like to schedule a test through our drive-through testing facility or one of our outlying clinics, or if you just have want general information about COVID-19. So until tomorrow, everybody, stay healthy.